going to say Dr. Lisa. I don't know what
Yes, say it. Claim it. Decree it.
Come on now. Our very own nurse, Dr. Lisa. I'm not going to let that go. Bless you, of God. Bless you.
Good morning, everyone, and happy Sunday. Thank you so much, Minister Allen, Brother Rob. Thank you, everyone. You're so kind. Today, I'm going to continue my topic on vitamins. There is a three-part segment. I realized a lot. People are asking questions, and so I want to make sure that I'm detailing the information that I give to you. So today's vitamins I'm going to go over is very important. I want you guys to listen carefully, and I'm going to go slowly as possible as I go through that. Now, I want to go back through something that we spoke about last week, because some people did not get this information. So I want to go back through it, or it wasn't clear. And that's a dietary allowance for magnesium, 7 to 12 months, 75 milligrams for male. Female is the same. 1 to 3 is 80. 4 to 8 years old, 130. 9 to 13 with 240. 14 to 18, 410 for male. 360 for the ladies, 19 to 30, 400 for the male, 310 for the ladies, 31 to 50, 420, 320 for the females, and 51 and up, 420 for the male and 320 for the female. So I hope that helped a little bit better. That wasn't clear. My apologies for that. So now we're going to get into the B vitamins. So since B vitamins are found in many foods, you're most likely not at risk for developing a deficiency as long as you follow a well-rounded diet. However, certain circumstances increases the need for B vitamins, making supplements necessary. People who are pregnant or nursing during pregnancy, the demand for B vitamins, particularly B12 and folate, grows. This is because they're needed to support fetal development, breastfeeding, and chest feeding, especially those who follow vegetarian or vegan diets. Supplementing B complex vitamins is crucial, as B12 or folate deficiency during pregnancy or while nursing can lead to severe neurological damage or birth defects in the fetus or infant. Older adults, as you age, your ability to absorb B12 decreases and your appetite declines, making it difficult for some people to get enough B12 through diet alone. So what are some foods that are rich in that, right? So for the B complex, your fish, beef, liver, chicken, eggs and dairy, fortified soy milk, beans, oats, spinach, bananas, nuts, and seeds. So for your B1, a lot of your nuts, your B2, your greens, your alfalfa, your watercress, your parsley. The B vitamins includes your B6, your B7, which is biotin, folic acid, and your B12, okay? So B complex may help prevent infections and help or promote brain function, cell health, proper nerve function, muscle tone, eyesight, energy levels, just to name a few. Deficiency in B12 has been linked to an increased rates, if you did not know this, of depression and mood disturbances in older people. B12 are naturally found in animal products like meat. So let's go through them each one by one. Someone asked me this question before, so I want to make sure that I'm thorough in that. So your B1 is thiamine. It plays an essential role in metabolism by helping convert nutrients into energy. The richest food sources include pork, sunflower seeds, and wheat germ. Your B2 is your riboflavin. And riboflavin helps convert food into energy and also acts as an antioxidant. Food highest in that are your organ meats, your beef, and your mushrooms. B3, niacin. Niacin plays a role in cellular signaling, metabolism, and DNA production and repair. Your food source for that is your chicken, your tuna, and your lentils. Your B5, like other B vitamins, pantothenic acid helps your body obtain energy from food and is also involved in hormone and cholesterol production. So liver, fish, yogurt, and avocado are all good sources of your B5. Your B6, pyridoxine, is involved in amino acid metabolism, red blood cell production, and a creation of neurotransmitters. Food highest in this vitamin are your chickpeas, your salmon, and your potatoes. Your B7, biotin, is essential for carbohydrate and fat metabolism and regulates gene expression. So you get then yeast, eggs, salmon, cheese, and liver, and among the best sources for that. Folate is needed for cell growth, amino acid metabolism, the formation of red and white blood cells, and proper cell division. It can be found in foods like leafy greens, liver, beans, or in supplements in the form of folic acid. And a lot of people, whenever they're pregnant, their doctors tend to make sure that they have this. B12, perhaps the most well-known to all the B vitamins, B12 is vital for neurological function, DNA production, and red blood cell development. B12 is naturally found in animal sources like your meats, eggs, seafood, and dairy. So your recommended dose for your B vitamins. For your thiamine, women, 1.5 milligram, men, 1.2. For your B2, 1.1 for the women, 1.4 for the men. Your niacin, 12 milligram for women, 16 for the men. Your B4, 5 milligram for women, 5 milligram for the men. B5, 1.3 for both. Biotin, 30 micrograms for women, 30 milligrams for the men. Your folate, 200 micrograms for women, 200 micrograms for men. And your B12, 1 microgram each. Let's talk about iron. Because a lot of women, a lot of females tend to be low in iron, but there are also men that also are low in iron. So iron is a mineral that the body needs to produce red blood cells. When the body does not get enough iron, it cannot produce the number of normal red blood cells needed to keep you in good health. Lack of iron may lead to unusual tiredness, shortness of breath, a decrease in physical performance, and learning problems in children and adults, and may increase your chance of getting an infection. So what is the recommended daily intake? Now, babies should be able to get all of this from their mom as they breastfeed, right? So birth to 6 months, 0.27 milligrams for the male and 0.27 for the female. 7 to 12 months, 11 milligrams on both. 1 to 3, 7 milligrams. 4 to 8, 10 milligrams. 9 to 13, 8 milligrams. 14 to 18, 11 milligrams for the male, 15 for the female. 19 to 50, 8 milligrams for the male and 18 for the female. A pregnant female, 27 milligrams. And if you're lactating, it's 9 milligrams. 51 and older, about 8 milligrams. Okay. Iron-rich foods. Some of us may not like some of these, and some of us may love it. So some iron-rich food, liver, a lot of people don't like liver, pork, beef, egg yolk, shrimp, clams, dried apricots, potatoes with skin, broccoli, your dried beans and green peas, spinach, raisins, watermelon, tomatoes, bell peppers, kiwi, sweet potatoes. I went over I believe I said broccoli already, papaya, strawberries, and even oranges. And we use oranges when we take in our iron because it helps you to absorb better to your body, which we'll go over another time. Other sources of iron. So spinach, by the way, 2 tablespoons of that gives you 0.75 milligrams of iron. Your beans, your chickpeas, 2 tablespoons give you about 0.5 milligrams. So, you know, like how children, it's hard sometimes to get them to eat things. These are little things for you to be creative with the kids as they go to school. Raisins, about 2 tablespoons of that, give them 0.5 milligrams. Fortified cereal, about 2 tablespoons, give them 2.5 milligrams. So there's a lot of things that you can work with when it comes to not only the adults, but also for the children. And on the right of me, which is to the left of you, you'll see the sources of what gives you the iron for the adults, especially when you're vegetarians. So your cup of cooked soybeans give you about 8.8 milligrams. So that's a good amount of iron that you're getting there as a vegetarian. Just make sure that you're eating enough of these vegetables to ensure that you don't become anemic and have the effects of that. 2 tablespoons of hemp seed give you about 2.8 milligrams of that as well. And dried apricots, which I love, half a cup of that give you about 1.7 milligrams. Okay, so let's talk about selenium. It's an essential trace mineral found in soil, water, and some foods. It is an important factor in many body processes. Selenium increases antioxidant effects in the body, if you did not know that. People commonly use selenium for selenium deficiency and to reduce the high risk for high blood pressure during pregnancy. It is also used for prostate cancer, complications from statin drugs, abnormal cholesterol levels, cataracts, and many other conditions. But there is no definite scientific evidence to support it, but a lot of people have reported that these have worked for them. Even for COVID-19, people said that it worked for them. So the recommended dietary allowance, the RDA recommends 55 micrograms daily for all people 19 years and older, while pregnant women is 60 micrograms daily, and breastfeeding, 70 micrograms daily. Foods that are high in selenium are your Brazil nuts, yellowfin tuna, halibut, sardines, grass-fed beef, turkey, boneless, beef liver, chicken, eggs, spinach, just to name a few. Other things, I already went to these, even cottage cheese, your baked beans, spinach, and oatmeal. Next Sunday, we're gonna continue on our vitamins. And we're gonna talk about the interactions with some of these vitamins. So I hope this was helpful for those that requested it. If it was not helpful, please let me know. I'll be happy to come back and add more items to that. God bless you and enjoy the rest of the service.